Non-anesthetic dentals. Doc is not a believer in that whatsoever. Good morning, Dr. Joel Saylor. We're talking about getting a dental, teeth cleaning and what have you. Maybe humans can get away with, just staying awake, but it's not a great idea for the pet.
No, this is a trend that we're starting to see more of, and the problem is it just doesn't work.
You don't like it?
No, because again, there's a lot of problems that can happen with it. There's no physical way to clean the teeth adequately with a non-anesthetic procedure.
What do? They hold the pet while you're doing it?
And they just hand scale. And you can, I know a lot of dental hygienists that hand scale their dog's teeth.
Right.
But most dental hygienists also know that there's subgingival cleaning and stuff like that they do, and so they're not depending on that only. What I'm talking about is you see some of these mobile facilities, and even some groomers have got involved in doing this, where they're doing a non-anesthetic dental. They're advertising this. This is a bad practice, okay? Because one, even when you're hand scaling the teeth, you're making pits and nicks in the enamel that need to be polished off, because even when they clean our teeth, they're going back and they're polishing those etchings off of the teeth, okay? And if you leave those etchings, it makes it even easier for the bacteria to recolonize. So that's the reason we polish teeth, not to make them shiny, but to make a very slick tooth, which makes it harder for bacteria to recolonize. The other thing too, you just cannot get underneath the gum line appropriately, because you need to go in there. The other thing, you need to be probing these sulcus to see if there's any problem areas. And also too, a key component of every dental should be dental x-rays. Okay, your pet should, every time they get a dental, unless they're getting them, they're on every 6 months or every 3 month kind of cycle, they should be getting dental x-rays as part of that exam, because you don't know if the tooth's broken off and that tooth is either missing. I can't tell you how many times we've x-rayed and you look and it looks like there's no tooth there, but there's a half a tooth underneath the gum line. Well, that's not normal, and you got to go get those. Okay, and so you cannot do that with the non-anesthetic dental. So the reason I bring it up, it's a big enough trend now that the major, AVMA, American Animal Hospital Association, the Board of Veterinary Dentistry are now basically saying this we should not be doing that. And they've got all kinds of horror stories where stuff has been done or abscess has been created because of nicks and cuts and things, because there's just no way to do a good job doing that. And so again, as with a lot of things in life, if it looks cheap and too good to be true,
it usually
is too good to be true.
All right, and we'll be back right after this.